Good evening, guys. If you missed our Healthcare Heroes Zoom conference this evening, we have an amazing recap for you all. We have about an hour and a half video of all of the amazing things that was discussed tonight on our call with our healthcare community members. We hope you enjoy it. We had a panelist of mental health therapists, we had pharmacists, retail pharmacy, nursing, and just everyone in the healthcare field that kind of pulled together to share not only their experiences professionally, but their experiences personally. And we're also pulling together resources that we have to best support you, in addition to breaking down that 880-page stimulus bill in ways that best affects you as a healthcare worker, as an individual, and small business owner. So we hope you guys enjoy. Thanks.
Um, I'll be discussing how COVID-19 has affected the mental health community. Not only are as far as the clients that we serve, but as also us as providers, kind of what we're seeing in our office, what we're seeing in our businesses and things of that nature.
I'll go next. My name is Janelle Fields, and I am a senior benefit coder for CVS Health Corporate in Irving, Texas. I'll be talking about how COVID-19 has impacted our workload when it comes to pharmacy prescriptions on the PBM side of refill too soons and quantity limits are exceeded.
Hi, I am Bianca Avery. I am a political organizer and political strategist, and I am going to be here to try to break down pieces of that huge $2 trillion COVID-19 relief bill and answer questions regarding what it means.
My name is Melody Parker. I'm a licensed professional counselor supervisor, and I'll be talking about the effects of grief and loss and coping skills to manage everything that we're experiencing with the uncertainties of COVID-19.
Was that everybody? Melody, Dewan, Janelle. Okay, perfect. So my first question is going to be for Melody and Dewan. How has COVID-19 impacted your practices on a professional level, and then what is the greatest impact you guys have seen from your clients?
I know for me, just the transition of switching over to online or telehealth for my private practice, it's been a shift, it's a change. I have a few clients who prefer face-to-face, and we've scheduled out a couple of months from now. But for the most part, it was easy to transition. I do have a group to where we provide school-based mental health, and that's been the biggest struggle because the kids are used to us seeing them in the comforts of their own environment at the school. So business has been extremely slow, and then we're governed by two bodies. So whatever the school district suggests is appropriate, and then of course what the LPC ethics and rules are. So that's been the biggest struggle, trying to get parents on board and being able to provide continuing services for those families and students has been our main struggle. But people are still calling and they want help as far as the private practice is concerned, and they're okay with switching to online.
If I can jump in on that, I think Melanie makes a lot of great points, and I think that's kind of a similar issue that we're seeing is with the transition to virtual health, trying to get people who feel comfortable with getting online. You have a large community who's like, hey, I don't want to do services online, right? I am not trying to do services online. I want to do face-to-face. So trying to make sure we are still able to assist those clients. I know within my group, there's 4 of us and we're all in private practice, and I'm the only one who accepts insurance. So a lot of what they're doing is cash-based, and about 25% of my clients are insurance. So from that 75% that are cash, you're seeing them kind of stretch out appointments, right? Because you have a lot of people who are trying to hold on to their money. They're trying to make sure that, They don't need those money for other basic needs, as far as food, security, things of that nature. You have a lot of people that are worried about their finances, and even some of my clients who, what I would say, a little more wealthier, a little more established, they're still concerned. They're holding on to their money and things of that nature. I think making an adjustment for like our older population, many of my clients who are 50 and up, I mean, they're really struggling with trying to do the virtual assistants. They feel so comfortable with sitting in the office. I see a lot more referrals for suicide ideation. So you have a lot of people who, because of their different past issues, they feel like, hey, like, now I can't do anything. I feel like my life is being controlled by someone else. Why am I here? I even seen a lot of uprise with kind of domestic violence within couples. You see a lot of couples arguing more, fighting more, things of that nature. You see a lot of kids who are getting a little more trouble at home because they're with their parents a little more. But as far as kind of us for providers, I think we're kind of used to being able to shift and make those appropriate changes to make sure we can see our clients and meet them where their needs are.
I think that's really important with you meeting people where their needs are. And I think one of the things that's really going to come of this is some of our true gaps that we have, and really kind of fine tuning, in the future, looking at how can we better prepare our community for technology, because I mean, technology is coming, right? I think right now it just had to come a little bit faster than we anticipated, but I do think it kind of shows an opportunity for us to prepare, like you said, our elderly population or our parents of students who weren't used to being as involved, and now they have to be really, really engaged. And hopefully with that better engagement with technology, we'll see more improvement with care overall. So, Miss Melody, tell us a little bit about your practice and some of your recommendations on staying connected during the shelter in place. Maybe how that has impacted people who, you see a lot of the Instagram memes where people are extroverted and they're used to having to connect to people, and now they're kind of struggling. I'm an extroverted introvert, so I feel like I'm half struggling, half happy. But what are some of the ways that we can stay connected during the shelter in place?
There are several ways, and it's really just self-evaluation, asking yourself, can I get out of my comfort zone? And it doesn't have to be anything major. You can take little bitty steps to equal big steps, because it seems as though we're going to be in this predicament past Easter. And I know there's changes every day that we're hearing as far as the time frame that will be shelter in place. But this is a way for us to stay connected by doing the Zoom. And I know a lot of people may not be technology savvy, but even texting, FaceTime, Skype, there are a lot of parties that I've been seeing on Instagram and Facebook, dance parties, church parties, concerts for support in these perilous times, so to speak. There's Netflix movies, and I've been living in my neighborhood probably about 10 years, and I've never seen so many people outside just walking with their children and being free, I guess, one with nature, so to speak. And that's always something you can do, whether you have your mask on or not. A 5-minute walk down the street, or as you're checking your mail, that's getting some fresh air and sunlight on your skin. We need that vitamin D. Speaking to your neighbors, even just a phone call to check in. I know right now I'm from Oklahoma, so my grandmother lives in the country of Muskogee, and she's still doing pretty good for the most part. She'll be 93, but just checking in on her just to see how she's doing. A phone call can go a long ways. So it's getting out of texting each other to attempting to be connected with each other. A phone call, even playing, I've seen the sidewalk chalk, playing tic-tac-toe with your kids, hopscotch, bringing out those games that have collected dust, bringing back game night, even picnics within the home, so you don't want to go outside. Having a nice picnic, maybe with you and your significant other once the kids are in the bed. If there's all kind of thing, really the sky is the limit to what you want to do or what you feel safe to do, and making a routine. So if it's just 10 minutes a day that you're deciding to do. So I know every day at this time, I'm going outside, I'm walking to the end of the street, and I'm gonna call my loved one. That's what I do every time at 5 p.m. or me and the kids outside of myself, me and the kids at 10 in the morning, just after we get up and eat breakfast and do an online lesson, we're going outside or we're going to dance together. TikTok is the thing right now too, and doing TikTok. So it's really up to you, but as long as you create a routine, which I'll talk a little bit about later, because you know what to plan for, it's going to happen, you're going to have a connection.
Dewan, when she brought up coming up with a routine, that made me think about some of these people who are just kind of feeling like they're having some issues with loss of control.
Mhm.
Is that something you would also recommend? Because I thought about what you said, people who may be experiencing suicidal ideation and they have, experienced that loss of control or dealing with domestic violence. What would you recommend, kind of in like a short to-do list, kind of?
Mhm.
But what would you recommend that they could do to kind of navigate that right now? Because some people's anxiety level may be high and they don't realize that it is because of that loss of control or not being able to really be able to plan any more than 24 to 48 hours.
Well, to be honest with you, anybody who has um, called in and have said they've been in a domestic violence situation in which there was a fight, they were physical, then, I continue to make the same recommendations as far as, hey, you need to remove yourself from that home and call 911. But as far as like a lot of people who just find themselves arguing more and things of that nature, I've told them, hey, we can still, like Melody said, we can still go outside, right? So I think the unfortunate thing is people hear, okay, social distancing, and they think I can't go outside. Well, you can still go outside. You can walk around your block. I mean, if there's a park nearby, you can walk around the park or not. Sometimes there's power just getting in your car and driving around, right? Sometimes getting in your car and driving around, like I've been telling people, hey, that neighborhood that you've always wanted to move in, now's the time to kind of just go drive around it, right? Being able to find those coping skills, those things that you need to help you. If you're the type of person where you need that time to yourself, create it. Find ways to create that time to yourself. I think we have to get in the habit of creating COVID routines. I think so many people are afraid of what they're lost. They haven't really thought about what they've gained, right? You have the opportunity now to work on yourself. If there was a book you've wanted to write, or a book you've wanted to read, or you've wanted to work on your diet, so you wanted to eat healthier, or you wanted to kind of work out more, now is an opportunity to kind of incorporate some of those things into our schedule. A lot of us are still working, even if we're working from home, but maybe we've gained an extra hour because we're not commuting to work. So we've gained an extra hour. Let's make sure we're using that extra hour to do the things that we feel are going to make us feel better. If you want to go out and go gardening, that's good. You see a lot of people that are doing like these Zoom happy hours with their friends, and they may have a glass of wine and get on their friends and they may talk. Things like that. The more that you're connected to people, the better you're going to feel. Now it's the time to check in and reach out to your family. If you have that uncle or that aunt or your parents that you're concerned about, reach out to them, because again, sometimes we have information that we assume is common sense, and not everyone knows, right? Not everyone knows, because there's a lot of people who say, hey, I can't go outside. They think like, yes, you can. So I think making sure that we're communicating with people. I'm also been trying to talk with people about kind of reframing it. Like I said, instead of viewing it as, oh, this is the worst, I'm stuck in the house. Oh, this is cool. Now I can have time to clean my house, do a spring cleaning. But I've also been cautioning people, don't clean the whole house in one day. Do a room a day. Spread
Right.
out the chores a little bit. But I think a lot of it is mindset. And if we have a mindset like, hey, this is something that I'm dealing with, right? But we're all dealing with. So how can I make the best of it? Then I think those people are going to be in healthier situations. Unfortunately, we are seeing a lot of people who think of this as, again, my rights have been taken away from me. I have no freedom. I can't do anything. And because of that, their brains are not able to actually process those things. So telling people to create first aid kits, but a mental health first aid kit, which you put a bunch of things in there that you do to enjoy, that you have fun. And when you start feeling yourself stuck, reach in there, pick something out, an activity, whether it's read a book, write a letter or something, and go for it.
That's great. So you guys, just to kind of recap the COVID routine, or just kind of having a routine to help if you're experiencing any domestic violence issues, and these are recommendations we can make to those that we're seeing too. So not
Yes.
just for us, but if you know a friend or if you minister to a separate community, definitely sharing these resources. But I think perspective really matters, and kind of coming up with that mental health toolkit, which I think just helps coping in general. So we talked about kind of looking at what you gained. Miss Melody, can you highlight for us? You brought up a really good perspective about a lot of people are experiencing grief right now, and they may not know that they're experiencing grief. And so I brought up kind of a personal story in regards to my transition with COVID. That first week was really, really tough, and I didn't know why. And it was because I was experiencing some grief, some feeling of like empathy and loss for what was going on. But for people who may not be that self-aware and still may be carrying around that heaviness, or maybe not knowing how to navigate it, although they're aware of it, kind of describe to us how this situation is a part of grief. Like, how are we grieving in this situation?
And so grief, by definition, is a natural response to any type of loss. So it's not just death. It can be the loss of a job or a miscarriage, financial stability, which I think a lot of us may be experiencing right now, just trying to make sure that we have all of our ducks in a row, so to speak. And so anytime that you allow yourself to, one, be aware with what's going on with you, allow yourself to feel whatever it is you're feeling, because I know, especially in the health field, there are a lot of accommodations we have to make for other people before we can make those accommodations for ourselves. And for us to be the best health professional we can be, or whatever type of position we're in, it's always checking in with ourselves, right? Really looking at what we're capable of doing and what we're not capable of doing. And it's okay to say no. It's okay to recognize that I need 5 minutes of my time just to check in and get myself together before I'm able to assist someone else. And so it can be overwhelming and exhausting at times. And sometimes we have unexpected feelings of shock or anger. And because we don't have a lot of control as to what's going on, really being mindful of what you can control. I know Dewan said earlier, is really not thinking about the negative, but about the positive. What have I gained in this situation? Or based on my experience and my education and my knowledge, what can I do to endure everything that I'm going through right now, especially in the position? So with disbelief or guilt, because I can't be with my kids and I have to be at work because I'm in an essential position, really trying to understand what you can do in the moment and being mindful of that. Because what happened 5 minutes ago, you can't change it. And so we call that like mindfulness meditation, and that's one of the coping skills. Just being present and in the moment and really taking deep breaths. You know, we say just breathe, but really you need to be able to breathe. It allows your brain to reset, to focus on what you're doing and being present in the moment. Now, there are some stages to grief, and it doesn't mean you have to experience all of them to say that you have resolution, but just knowing what stage you're in so you know how to manage that feeling. So you have denial. You know, I can't believe that this is really happening. What can I do? Or you have anger. I'm upset because I have no control as to what's going on. Bargaining, well, if I do this, maybe this will happen. And then you have depression and acceptance. And I know for me, as far as my clients are concerned, it's a toss between anxiety and depression, especially now with not having control or just the uncertainty of what is to come or how long are we going to be in this predicament. So just really using some coping skills to manage through the anxiety and depression to get to acceptance, right? I accept that this is the position we're in, and I'm trying to be proactive instead of reactive. So mindfulness meditation is another coping skill. And there are a lot of YouTube videos that has some serene music, or if you want to get crunk with it, you know, listening to your favorite type of music, gospel music, rock, country, whatever it is, just to kind of reset your mind and be grounded. So what do I hear? What do I see? What do I smell? What do I feel? Even down to what do I taste? And just being more cognizant of what's going on with yourself. And then exercising or dancing. So we talked about the dance parties or TikTok, but if you get your body moving, this will help you manage what's going on, because you need an outlet to express what's going on. So before you help your next patient, client, family member, you have to get your body moving. The more you stay a recluse, so to speak, or in isolation, it can allow you to consume the negativity And before you know it, my thoughts have spiraled out of control, and it's 2 hours later. And so you can have those thoughts, but to really manage them and say, okay, let me pull myself back. Let me acknowledge what's going on. And in order for me to move forward, do I hold on to what I'm doing? Or do I realize that this is what I can do right now and take some little bitty steps, walking outside, taking a 5-minute breath, being present and in the moment so I can move forward.
Really
The one,
quickly
oh,
to jump in, because one of the things you said was managing emotions, and so I wanted to put some numbers out there because I think a lot of the frustrations, a lot of people managing emotions, both as community members and as healthcare professionals, had a lot to do with what we were seeing, right, and what the news was putting out, and kind of putting that fear and that anxiousness in us. So just to all of these numbers are from the Texas Department of Health. For the DFW area, our current case count is 2,552 COVID cases that are reported, and that's for the entire state of Texas. Of that, they have 34 deaths reported, and then a total of 25,483 people that are tested. Coming from the healthcare world and knowing each hospital and their access to testing. I know one of the things that frustrated me as a nurse and a lot of healthcare professionals is that you're on the front lines, but you can't get tested. And a lot of it was because of the access of tests. When you have 2,000, about 2,500 reported, and then the number of people in Texas is 30 million, so that's a really, really, really big gap in the number of people that are able to be tested versus, those who actually may need to be tested. And I know that frustrated a lot of people. And so what I saw was, we needed a place to kind of digest what that meant, not only just the discrepancies in numbers, access to tests, just all of these things that we seemingly just had no control over, but we saw was affecting us, was happening to us. So do you or Dewan have any maybe like specific coping measures when you're hearing this news, when you're hearing these numbers, when you're hearing this information that just kind of instantly makes you tense up or get frustrated, or get to a point where what you expect or what you want to happen is not happening? How can we navigate that and kind of put that in our toolbox?
so for me, I know we are our own best advocate. We know our bodies better than anyone, and we have to be willing to be assertive, to speak up for what we feel and what we know what's going on in our body. Everything is connected. So the way we take care of ourselves physically is going to affect us emotionally. That's down from what we're eating to how we're sleeping. And I know, as Dewan mentioned earlier, we might have an extra hour built in our time because we're not commuting back and forth to work. So really being intentional with our time. We're so used to, as Americans, going back and forth, going from here to there, and then, man, wishing I had some time just to sleep a little bit more or eat or spend time with my family. But now that we have it, are we really being intentional with our time and managing it well? So it goes back to creating a routine or a schedule for yourself and trying to follow it as best as possible. Because when you don't get sleep, your body will tell you it's time for you to sleep. When you see your eye or feel your eye twitching, or you feel the stress and pain in your neck and shoulders, that is your body telling you, hey, sit down and focus on yourself. And self-awareness is the big thing, right? And it's not just necessarily things that we want to do, but things that we need for ourselves. That means I'm turning my phone off 5 minutes early, and I'm gonna let my brain really process what happened today, and I'm gonna get some rest. So really being intentional, that's my word for the time being intentional to really hear what your body is saying, and really understanding that the way you take care of yourself physically is going to affect you emotionally and vice versa.
You know what? I think, all those things are very important. It's important that we manage our self-care. It's also important we manage our assumptions. Excuse me. I think one of the issues that you're seeing with a lot of people is when they see someone cough, or they see someone with a mask, or they see anything that is abnormal to what we're seeing on a regular basis, they have a natural fear response, and that fear response gets us in our head. I think we have to be mindful of how we're looking at a situation. I've been telling people minimize how much they have access to the internet or to the
And TV.
different I'm sorry, go ahead, Melanie.
Oh, I was gonna say, and TV for that matter.
Oh, yeah, the
Mhm.
internet, TV, the certain apps that you're getting with updates, try to find a trusted resource where you get your facts and kind of stick with that resource instead of kind of just having a bunch of different apps or a bunch of different outlooks that's giving us information. But we also have to be mindful of, sometimes the language, the things that we talk to ourselves about, that are self-talk. If I'm getting information and I'm like, that's awful, then of course, then a lot of things that come following that is going to have a negative response. But if I get some information, I'm like, that's interesting, or that's intriguing, or there's a sense of curiosity about what's going on, I'm more likely to have a better response of how I handle the information. So making sure that we're recognizing who we are. Some of us struggle with the amount of free time that we have. Some of us is not used to this amount of free time, and we're used to working Monday through Friday, off on the weekends, and we have our weekend routine, and we're trying to stretch those out into our days. And I want people to be mindful of trying to create new things that you can do for yourself. Sometimes we don't have the proper tools in our toolbox to deal with this, but we can create new tools, right? Some people may not like gardening. Me and my son, we picked up going out riding bikes in the evening. I went out and bought me some seeds. I'm gonna see if I can make some plant some potatoes. I know nothing about gardening, but that time that I'm going to learn on YouTube, trying to figure out how to do it and planting it, is going to be a healthy distraction, right? I'm learning how to take care of myself as far as being able to, make food for myself, but I'm also creating something that's going to allow me to get out of the house, get sun, and feel better. So sometimes we have to figure out that thing that I've always wanted to learn. Let's do it now, right? That peach cobbler or whatever that you always wanted to make, like, let's try to make that now, because gives us the opportunity to have healthy distractions. I'm trying to make sure that people aren't picking up, more alcohol, more drugs, and things of that nature, because again, those are things that are going to only exacerbate our issues later on, particularly when you have maybe substance abuse issues or you have grief. Trying to ignore it in a way that's unhealthy can only lead to more problems.
So I like what you both said about picking up and creating healthy habits, and a lot about making sure that the information that you're
Mhm.
receiving is from just kind of a reliable source. I did see a shift after about a week or two where we kind of stopped focusing on how many people were dying and started focusing on how many people were actually, living and recovering. And so it was really just kind of refreshing, because I don't think we had even thought to say, okay, if 10,000 people died, how many actually lived? Or, if these people struggle, how many people actually went home, was able to quarantine and get better? So I appreciate both of those things. I think it's disrupted our personal lifestyles, our professional lifestyles. I want to hear from Dr. Showers and from Janelle in regards to how has this impacted you guys in pharmacy. And so really looking at, a lot of our healthcare as a system is about delivery of care. And so we deliver care on in a lot of different ways, especially outpatient care. So people who are relying on our system to run efficiently in order for us to get the meds that we need, get our appointments together. I know a lot of people have been having to either cancel appointments or telehealth appointments. But what does that look like from the pharmacy and people who rely on their medications for, immunotherapy or, for major, major functions? Janelle, if you want to answer that one.
Yeah, I'll go ahead and ease into that one. So I've been on both sides of the pharmacy. I've been on the front end as a technician in the very beginning, dealing with patients front hand, and our actual pharmacy had delivery. So I know at that time, and probably now, even though I'm not on the front end, it's probably a little too much trying to make sure that we get the medications out to the patients at a certain time to make sure that they have the medication that they need. But, when it comes, legal standpoint, and we're not able to refill medications too soon, or our quantity limits have extended, then it goes on to the back end of where I'm at. I'm on the PBM side, and I do all of the coding for employer benefits, Medicaid, Medicare, on specialty medications, and those are the high end drugs. So we're bypassing the referrals, the recommendations from the doctor's office, and going ahead and filling those medications, because these are top dollar medications. These are HIV meds, these are cancer drugs, And these people can't be without those medications, regardless of the time frame that we're in and the pandemic that we're currently living through. So for me, in my role, we're actually not even busy during this time of the year. Our welcome season or our high volume is actually at the end of the summer towards the end of the year before 1/1 hits, due to new plans coming, and we're getting new benefits, and and medical benefits and dental and vision and pharmacy benefits. They all start on 1/1. So now I've been on calls all last week for different medications that we have to actually go back into the plans that I've coded from the very beginning and make changes to the back end to make sure that those particular medications pay on the front end. So I've been up all night doing most of those plans myself and what we cover here in the Texas region, but they're for all of the Fortune 500 companies that we work for. So it's been a lot. But I think we've maintained, even leaving the office, we can't even be in the office anymore. So I'm pretty much work from home anyways. So it doesn't really take a toll too much on professional. It's still business as usual. We still do our WebEx and our town hall calls at home. But for a patient or, a patient standpoint, it could be a little stressful. I don't talk to doctor's office directly, but when I was in that role, I know that side of the business is pretty much booming right
It's
now
a
with
lot.
calls back to
Yeah.
back. You can barely get into a doctor's office or, specialty offices by phone now. They're
Yeah, the process is really backed up. And so I was curious, it seems like it could be balancing out, but do you find that it's harder or easier for patients to get their medications?
um I think it's pretty easy, and I think it kind of relies on my side of the business on the back end to make sure that we put the plan in place so that the quantity limit is overrided, the refill too soon for your 30, 60, or 90-day drugs is overrided so that they can get those medications. It may be a little strenuous for people who don't have mail order and they're actually they elected to pick up their medications from the actual pharmacy, whether that be Walgreens or CVS, and we have to move those patients to mail order instead of picking them up. So that might be the only thing that is holding them up. But for right now, I think they're all paying as they should, and business is still as usual. So still
Okay.
happening, still going forward. I don't
Okay.
see any decline on our end as far as workload or slowing down business wise. I think we're still going to be pretty busy.
Okay. So I wanted to kind of use this opportunity to transition. I think one of our other panelists was not able to join us, but I want to go ahead and divulge into the stimulus relief bill and then leave an opportunity for you guys to ask some questions to anyone, as well as share. I know a lot of people joined just to listen, but I wanted to make sure I left an open forum for people who wanted to discuss issues or questions that they may have. Since we are a community, it is open, to all. So I want us to be able to touch on the stimulus bill and then maybe open the platform up for people to ask questions, share what they're going through. I fear that people are going through things in silo, and I think sometimes healthcare is oftentimes silo. And so, which was what the need for this community came from, is that we kind of experience things a lot differently than other industries in the rest of the world. So we'll hear about the stimulus bill, and then if you feel compelled to either share your experience or ask a question, please feel free to. So Miss Bianca, go ahead and introduce yourself. She's awesome, and I'm really happy she was able to join us today because she's going to give us some facts about this bill. I've been looking up things, so I got some questions, and I hope you guys have at least had at least an overview of the bill and will know how it affects you. So please go ahead and introduce yourself and share.
All right. First of all, thanks for the invitation and thank you all for your time. I'm going to do my best. I'm Bianca Avery. In case you came in a little after we first started speaking, I am a political organizer and political strategist. So basically, I get to work in both sides of grassroots and grass tops. So, in trying to bring those sides together to work together. But we're about to try to tackle this bill, and I bullet pointed a lot of things. So if you have questions, please feel free to throw them in the chat or everything, because this bill is 880 pages long.
Mm,
I'm
mm.
just saying that in case you just wanted to download that sucker, try to read it. But it is 880 pages long. And I pulled out a lot of the key information that deals with healthcare and how funds are going to be allocated, about states, as well as maybe some more personalized information about how it will affect you as far as credit, as far as the payouts you hear a lot about, and even as far as student loan, because that comes out a lot often. Khalid, did you want me just to dive in, or do you want me to go along with?
Yeah, I mean, I think our top three focuses would be those who are providers who may have felt the impact as a small business,
Mm,
those who are healthcare professionals who either lost their job or may be looking for how they qualify for the stimulus, and then, like you said, student loans. You can always share more about student loans.
okay. Um, well, I'll go backwards. I'm gonna start with student loans because as soon as you said it, my eyes went to it. I have mixed news. I'm going to try to just keep this very like straightforward. This is the bill we have. I think for the time now, dissecting of whether or not you think it's a good bill or a bad bill is probably a whole nother discussion that we could dig into. But as of it getting signed on Friday, this is what we're working with now. It was a 2 trillion, really like $2.2 trillion bill, um, which is it's massive, and it's only one part. Student loans, the only part I pulled out deals with if you have a federal student loan. So if you have them through private banks and entities, what I'm about to say does not impact those directly. Those are going to be case by case, and I wish I had a better answer because I'm sure a lot of people have that situation. Those right now are lender by lender. However, if you have a federal student loan, your payments with no fees, like no accrual of anything, your payments right now are suspended at least until September 30th. That's one of the few that I have a hard date for you. It doesn't mean things could get extended if this goes way further than we really probably are imagining or hoping. But right now, at least as of that bill, there is a payment suspension on federal student loans until September 30th. What I am going to tell you, as someone that actually works for government and has dealt with government as a just civilian, double check that. Make sure, like I would sign on to your provider and make sure that it's showing that you have a zero due on whenever your next payment was going to say or whatever. Just double check. They have to suspend them, but we also know things happen, and I'd rather you know now and contact whoever it is you need to contact than go into August and September and say, what are these fees according to this
Mhm.
bill? I shouldn't have these. So I'm just all about a proactive approach to make sure they have you set. If you were part of one of those forgiveness programs where you need to have the payments for 10 years straight, last I heard is for every, I think it's 6 months, they'll count as like you made a payment. Like these won't stop it. You're not going to restart. You're not going to lose that you've done this many in a row, but they're not going to count each one of these skipped months as a payment either. But they said if it goes past 6 months, as of now, they'll still like count that as one of your 120 payments or whatnot. So it won't count against you, but they'll give you a little credit as if you're still paying it, even though you're not. Um, for as far as your actual personal credit, from January 31st until 120 days after we get out this national emergency declaration, which we don't know when that is. So whenever the president says we are no longer under a national emergency declaration, 120 days after that um, is when basically all your lenders, all those wonderful people on your credit report, they're supposed to be marking you as current during this time. If you weren't current prior to it, those don't disappear, But they said from January 31st all the way until 120 days after this declaration ends, you should just see it marked as current. So even if you were behind in payments in December and January, those will still show. But after that, it should just show current on your credit report until we come out of this. That was actually part of the bill as well. And oh, there we go. Your money, this check we keep hearing about, right? This
Mhm.
almost universal basic income that people said was impossible, but all of a sudden, anyway.
It's possible.
Okay, this is how it works. I'm going to pause after I say this part to see if it made sense. Okay. So most adults, most, not all, and I'm going to break down how this works. Most adults are scheduled or going to get $1,200, but some will get less, and I'm going to break that part down for you. Also, for every qualifying child age 16, that's important for those of you that have some teens in the house, 16 or under, you get an additional $500. I bring that up because if you have a 17-year-old in the house, or 18-year-old, or just a college student or someone that's working from home, if you have a 17-year-old, they're not counted in this. For whatever reason, 16 was the age that got put in the bill. 16 is the age that it is. So I'm just putting that out there. Currently, there is only money allocated for one payment as
Mm.
of this bill. Now, you're probably going to see a series of bills as we go, which means they might extend that. The next package that comes up might have another one on there. But as of this bill, it shows one. And how do they determine what do you make? Okay. Or what do you get? So that depends on your income. And also, it depends on if you have not filed 2018 or 2019. I'll take they're going to go by your 2018 tax return unless you've already put your 2019 in. That's why they keep saying 2018, because they've extended the deadline for 2019, so they're not like punishing people for not having 2019 in. That's why you keep hearing them say we're going to use 2018. If some of you have jumped fly and been great and on top of it and already put your 2019 in, that's the one they're going to use. I'm just putting you out there. For some people, it would have been nice to know ahead of time, but this is just where we are. If you are a single adult with a social security number, there's some back and forth about this, but currently, as of I'm reading what's on there, with a social security number, if you have an adjusted gross income of 75,000 or less, you're getting the full amount. That's for an individual. If you are married with no children, you can earn up to 150,000 or less to get that double payment of it would add up to 2,400 because two adults. And if you are the head of a household, if you're filing as head of household, some people on here do that. You can get the full payment if you earned less than 112,500. Kind of like that whole you're the only one working, you're the head of this household. There's multiple people, another adult. You can make a little more because of that. Okay, if you make more than that, the payment decreases until it stops altogether. I don't have the formula of how it decreases off top, but basically the payment decreases little by little as you go above that. And so the cap is if you have no children, you have no dependents, and you can make up to 99,000 and still get some type of payment if you are single with no dependents. It will not be the $1,200. I don't know off top the math to tell you where you would. I'm sure there'll be some calculators coming out real soon. And then also, if you are married people, wait, no, someone already said, come on, Alexandra, thank you. Check the chat.
I'm sorry, because Alex is so fire with
Yes,
information, so I'm not
great.
surprised.
Appreciate you. So, and if you're married people with no children, you can earn up to 198,000. According to the Finance Committee, the Senate Finance Committee, a family with, this is an example, a family with two children will be no longer eligible for any payments if you make more than 218,000. So as they brought, there's a calculator when you add children in, the amount that you can have goes up and down. So it doesn't mean you won't get anything, but there is a cap the higher you are as far as expecting it. It will take a while if you're trying to get a paper check. If the government has your direct deposit information, like if you do your taxes and you were getting a return and you kind of set it up to get it in your account, that is most likely the way you're going to receive it within, they say 3 weeks. I just always say double that times two. But supposedly they're trying to get it out within 2 weeks. If they're talking about mailing it, you may be talking like 8 weeks potentially. So that's where that is. Now I'm gonna scroll up. I'm gonna pause. Do we have any questions on that part? I know it's still a lot.
I have a
You guys
question.
can feel free to unmute your videos. It's nice to kind of see some faces, and then unmute your microphones if you have a question.
And then I'll take some questions here before I dive into the breakdown of the hospital virus prevention, like all that part of the bill, how they broke that down.
I have a question. I've been writing my questions down as you were going through this. So you went through how the loans are only affected with people who have William D. Ford federal direct loans. What about people who have their loans in forbearance and we're using our allocated 3 years max on our loans?
Forbearance, I have a loan that's in forbearance too.
I do too.
Currently, again, if they are a federally backed loan, Fannie, Freddie, and all they friends, okay,
Yes.
you should not be paying any interest or any additional fees or anything on those loans while they are sitting, and you should not have to pay them, but also you shouldn't be accruing the
So
interest.
the accrued interest would not.
It should stop. Again, I myself am spending next week trying to make sure that
Right.
has happened, but no, interest and things like that should not be accruing fees, anything. All of that's supposed to come to a hard stop if it's a federally backed loan.
I think more so I would probably have to call my lender because I'm just trying to see, will I be able to get that 6-month time back and put back towards the forbearance so that it's not allocated to the up to 3 years that you can place your loans
Right.
in forbearance. I was in financial aid in undergrad and grad, so
Right.
I'm trying to make sure that all of that was accounted for.
Actually, I'm going to write that down. That's actually a good question that affects me personally as well, to make sure, because I know how it affects as far as when people are accounting to make sure their payments are current. But you're right, as far as forbearance on that limit, I'm hoping that this time
That
does
they
not
take
affect,
that time.
but I don't have a clear, the packet I got, I'm just going to throw it out there. I work for the Dem Party on the congressional side. So the information I've received breaking down the bill, I did not see that. But again, with it 180 pages, it doesn't mean it's not in there. It just means that wasn't part of the breakdown I received. So I will definitely look that up specifically, and I wrote it down. So
Perfect.
yeah.
One more question.
Janelle, can I interject really quick to answer that last portion? I have student loans in forbearance because I just finished graduate school. You know how you have the grace period is what they call it. When I try to reach out to my loan service provider, and if you log online, it's probably the best way for them to state the best way to reach out to them. Just because my loan service provider, their office, the physical office where their call center is shut down due to the non-essential thing that we have in place right now. So right now, your loan service provider will probably tell you the best way to contact them. Right now, I do not have the luxury or the liberty to call them and speak with a physical person to get my answers answered, because I do want to know, does that 6 months or, whatever the time period start over after the, September deadline? So right now they are telling us to email them, and then they are having representatives sit at the computer that are working from home that are answering clients and customers' emails. So I don't know if you have access to either an app or just a website for that provider, but they'll tell you the best way to contact them, because I know my particular provider, they are not allowed to go into the office because of the virus. So
okay, yeah, I'll probably take a look on the app. I have the app, so I'll look there. Bianca, I have one more question. There were so many articles going back and forth with Tax Act and TurboTax, and I'm trying to make sure. So the deadline has extended to July 15th, or is
Yes.
it April 15th?
No, the deadline has extended to July 15th.
Okay.
Yes.
So the
Okay.
time to get your tax returns for 2019 in is now
July 15th.
Yes.
July 15th.
Yes.
This weekend was supposed to be when I was going to do my taxes because it's just been crazy.
Right.
But I didn't know if the deadline extended, and then I've been seeing articles where it came back and it said, no, it's not extended till
It's
July 15th. So,
yeah. It's yeah, it is July. It is definitely extended to July 15th before it's marked where you should have gotten an extension or you're late or anything like that.
okay. So no amended or anything like that would be after July 15th.
Right.
Okay. That relieves some stress.
um, I am about to dig in on the next part of the bill. I'm going to try to condense this part because it's still really long. Again, the bill was $2.2 trillion. 150 billion goes towards states. Like it's just a pot for all the different states. Every state's getting at minimum like 1.2 billion, like a Rhode Island, all the way
Oh, and they
up.
can allocate how they want.
Yeah, it's to
So we
support.
can write them and ask them. I'm just playing.
And my Texas people, Governor Abbott just had a press conference, I'm sorry, that I need to go read through. I'm hearing it was a little repetitive, but I did not watch it. It seemed like it was dealing with closing like our state border with Louisiana and some other things. So check that out. If I have not got a chance to watch it yet, because I went from call to call, but check that out because our governor has spoken. So please take a look at that, especially if you have a family in Louisiana. That's the part my phone blew up about that. So
Mhm.
I have to check that. And I think air travel from certain states as well. But I know as far as car travel, he's talking about the border between our state and Louisiana.
Thank
So,
you,
oh yeah,
Jeanette.
and
She said that
Jeanette,
he officially confirmed that our convention center will be one of the expanded hospitals.
hospitals, yes. So currently, like I said, there is money allocated for each state. Native tribes actually are also given an $8 billion pot. And one of the things is, I do want to also tell you, when you guys are looking everything up, sometimes this is just called like a coronavirus or COVID-19 relief bill. The official name is the CARES Act,
Oh,
which,
okay.
yeah, which stands for the Corona Aid Relief and Economic Security Act. You can find it either way, but if you see like the CARES 2020 Act and you're like, what is that? That's this. That's the Relief Act. Okay. I just wanted to let you know because it comes up both ways. And I had someone email me about what's this other bill? I'm like, it's the same bill. Don't worry.
Can you read what it stands for again?
Yes, it's the Coronavirus Aid Relief and Economic Security Act. So it's
Can
the
you type that in the chat? I'm sorry.
I will.
I'll type
Okay,
it
thank
in.
you.
I'll type it in
Okay.
so she can
Thank you.
continue. Yeah.
Cool. And if not, like I said at the end, I can jump back on too. Yes, that's it. All right. So here's how it breaks down for hospitals and hospital entities. Okay, it's about 180 billion of the couple trillion is earmarked specifically for the healthcare sector, and going towards equipment, infrastructure, which includes the protective equipment that's very desperately needed testing supplies, training, and new construction, which could be constructing of whole buildings, or it also could be converting buildings. Also, a portion is going to be spent on Medicare payment increases, medical research, and expansion of the nation's stockpile of medical equipment for emergencies. I guess it was one of those, oh, we should have had more of these things. Let's make sure we get them in there.
Well, and I think the biggest thing with the mask that I don't think has ever been brought to light is that we don't manufacture masks locally. We do it domestically, and so because China was hit, they were our main source for making masks. So hopefully, the hospitals or whoever's in charge of manufacturing brings that back locally, either to help create jobs or to help just kind of support that in general, the equipment that's needed. A good way it was described to me was it's kind of like the supply and demand with the toilet paper. It was like grocery stores had enough toilet paper for the current demand that was needed. So we had enough PPE for the current demand that we were using it, but we hadn't planned for 500 people to run to the grocery store and just take toilet paper. So
Right.
when people started doing that, that's when it kind of threw it off. But yes, definitely, I hope they prepare for that better.
Yes. So, like I said, it's a mix of the current preparation and also trying to redo structure so that if hopefully it won't be anytime soon, but that if we come across something like this again, we have some stockpiled items prepared for at least the initial phases of it. So now this is going to be real numbery and wordy. I'm just kind of breaking it down so you can just see where money is going right now. I wouldn't even recommend trying to memorize the numbers, but I just want to give you an idea. So 100 billion is going towards and is literally put as a new program to provide direct aid to healthcare institutions on the front line. That includes hospitals, anything considered a public health entity, also some nonprofit entities, Medicare and Medicaid enrolled suppliers and institutional providers. 16 billion to get the stockpile up of the pharmaceuticals, the PPE, the personal protective equipment, and other medical supplies that are going to get distributed to state and local health agencies. Like I said, this is outside of the money going to states to kind of say, here's some money to help you with what your state's saying you need. This is stuff
Gotcha.
the national government saying we're just going to provide. Especially, and it's going to be a lot of different places, but it seemed like they gave a lot of leeway to especially places facing shortages during emergencies. Um, so they're going to kind of look at it case by case in some ways, which places are the most in shortage and most need, and try to get supplies to them as quickly as possible. They're also giving 3.5 billion to help expand the production of vaccines, therapeutics, and diagnosis. And I'm scrolling down, and this is a big one. This kind of touches on what you were mentioning, and some of you may have heard a big thing about the president telling GE and other companies that we're going to make, well, General Motors, not GE,
Hmm.
GM, that they're basically using an act to say you're going to still help make ventilators or whatever it is he wants them to make. $1 billion went towards something called the Defense Production Act, and that's to bolster the domestic supply chains and enable industries to ramp up production of those protective devices, ventilators, and anything urgently needed. There's some talk on the other side. That's another conversation about where the checks and balances are for that. Like, how much leeway does this give him to say you have to do this and this company has to do that? But that's what that is, the Defense Production Act, meaning getting certain companies that have the, I guess, manufacturing space or ability to say, we need you to switch, make less of what you normally make, and I need you to help use your factories to get these ventilators or masks or whatever else. We got to get it done now. So that is in there. And I'm skipping down 200 million for the Centers of Medicare and Medicaid to assist nursing homes with infection control and
Hmm.
support states' efforts to prevent the spread of coronavirus in nursing homes. So 200 million goes straight up for trying to prevent spread and do support in nursing homes specifically, like
That's
not
good
dealing with any
because that
other.
was the primary source of it
Mhm.
spreading.
Yes. So that is put aside. I feel like that number will increase as far as the amount, but that's what's aside now. And they're also looking to put 15 billion to help the nation's veterans, um, to include help treating COVID-19, purchase test kits, and get more of the protective for clinicians. I know they're trying to definitely call in people that have been on reserves and duty to kind of help assist in this.
How much
And
was that
then,
number again? I'm sorry.
okay, no problem. 15, and I'll probably just email this to you too, Kalia.
Okay,
Uh,
thank you.
15.85 billion. Now the next part speaks to our really the previous folks that were talking. They did put some money in for mental health services. They put 425 million in a pot. We'll see how it gets broken down and allocated, but there's $425 million to increase access to mental health services in communities during this time with all the sheltering in place, lockdown, and
Mm.
You know, a lot of our communities we already know struggled with access to it, so this wasn't helping. So they did put 425 million specifically earmarked to look at how they can support mental health resources and services.
That's beautiful. Okay.
I have a question. Is there
Yes.
anything in there regarding homeless people?
Mm.
Hmm.
Who is
So
that? Go ahead and announce yourself.
Hi, it's Portia.
Hi, Portia.
now that's been interesting. I've looked. I feel like part of that, and I'll say fortunately or unfortunately, it depends on how you feel about the local control in this situation in a national security kind of public health issue and crisis. From what I saw, there is funding, and I'm going to try to flip in a moment my screen over to when they talked about housing. But most of what I saw that was specific on a federal level had to do with federally backed mortgages and things for renters and people that own
Mm.
homes. It seems like the homeless response, the unhoused response, has been mostly given to states and municipalities, like your states and your cities. I'm not sure, like when they get that money that's earmarked for the states, how many markers there are, like how much fluidity does the state and the local have to use it? Or I used to be a teacher, so I know like some money we would get, it was very specific. You have to use it for this thing, and then some money you had a little bit of we can use it for this or that. I'm not sure how the state breakdown is. Everything I see, I have yet to see a national response or anything that come across my email at all in the last month that dealt with unhoused populations from a national federal level. So that's a huge thing that I think needs to be looked at, but I have not seen anything from a federal level. So
I had a question. It's so interesting, and I'll be curious to see how the hospital, uses this money because even your first line item was like 100 billion for frontline healthcare institutions. I'm sure they have some leeway to allocate it how they see fit. One of the things that I have seen in hospitals that has been working, and these are for if you're a frontline healthcare worker, because they aren't getting hazardous pay. The collective bargaining has been helping a lot. So if you are around people who feel like they need to be getting paid more because they are on the front lines, kind of coming together and collecting signatures, sending emails, and sending that up the chain of command has definitely helped because a lot of these institutions, maybe not now that they have more access to money to get PPE, but they have been fearing nurse strikes. And so if you kind of come to them in a collective manner, they're gonna automatically think, okay, we don't want them to strike. And I've actually seen it work at a hospital where they all just continuously emailed their leadership teams with signatures, and they were able to at least get a seat at the table. And it just reminded me of the importance of having a community of people who are like-minded and advocating for the same thing, because now that is an agenda item that has to be seriously considered, or they will lose their entire department of people who are upset about it. So
there's
that, I
there's
mean, it's just
actually
empowering.
there's been actually talks from certain I guess more progressive, we want to use that big umbrella term word, progressive members of, I think, both the Congress and the Senate, but particularly in the Congress, of trying to really fight to make sure medical healthcare workers, as well as other workers who have been deemed essential and have been working on the front lines of this battle, basically trying to make it like the same as some of the protections, benefits, and resources that even like a veteran on the front lines of something would get, because you're putting your day-to-day life, health, safety, working long hours, front line in the midst of everything that's going on. And there's been some talk. Now, the movement of it, honestly, there's a whole lot of noise politically right now, um, which unfortunately means sometimes it starts becoming more of a political tug of war. In the midst of that, people lose sight of we're supposed to be doing things for people and helping people right now. But there is becoming a clamoring of a lot of more noise and more add-on, and I'll say good noise this time, of folks that are trying to make sure that those people, one, definitely that healthcare workers and whatnot get treated the same as some veterans and some protections after this and this unprecedented kind of event and all the asks that are being made. And addition to that, on the side, there's also the push for anyone right now that's deemed essential needs to
Right.
be getting something, whether it's through
Right.
pay, through support, union, or whatever. It's like if they're saying you're essential for this country, then we need to be
Then you're
treating
more at
with
risk
some
than.
essential support. So
And then the last topic before I open it up to some
yes.
questions, were you able to find any information on small businesses? I know a lot of us as healthcare workers have either a side hustle, whether it's directly related to healthcare or not. And I'm just curious what relief do they have?
Okay. One of the first ones that I do have pulled up, I have a small business rescue plan pulled up. And then I also have some unemployment information pulled up too, just in case for those, unfortunately, that are in that boat. Um, but the small business rescue plan, I have just a brief overview of it, guys. So I pulled it up. $377 billion of this went towards it. So what it's giving right now is 350 billion, not to one person now, you know, that's the plug, and in loan forgiveness grants to small businesses and nonprofits to maintain one, their existing workforce, and I'm going to bring a point up about that, their
Mhm.
existing workforce, and to help pay for other expenses like rent, mortgage, and utilities. The point about the existing workforce is basically to really break it down really simple, it's almost like if you have a small business with 10 employees, if you apply for this, one of the caveats would be to make it as something like it almost seems like a loan. And I can't promise you that things don't change throughout. But as it stands now, it's almost like, well, we'll give you this money, but some of this money needs to go towards you being able to keep these people on and pay them. And if you do that during this time, at the end, basically it turns into a grant as opposed to a loan. Like you won't have to
Gotcha.
pay all this back, or it'll be different of how it's structured of how it pays back to kind of benefit you. That's just one program in this $350 billion pot. You can look up something and probably get different requirements for like multiple programs, but I know one program there's a benefit to, hey, you keep your folks on. That's what this is for, because we're trying to chip away at this huge unemployment right now, which I said I'll get to that in a moment. They also are given 10 billion in small business emergency grants of up to $10,000 to provide immediate relief for small business operating costs. I believe that was a program that was in place in emergency times. They just expanded it by adding 10 billion more dollars to it. And then they want to give, not want, they have, it's signed now, $17 billion for small businesses to cover 6 months of payments. So if you basically have existing small business loans through whatever entities or whatever banks that maybe are saying, hey, it's cool, we still don't want our money, like we still collecting those kind of things, loans. They basically put aside money to help people if you have loans or payments that are your own personal private things with banks, and maybe the bank is saying something like, well, we won't, you're okay for these months, but as soon as this is over, you're going to owe us all this money that's due or whatnot. Basically, it's a resource to help small businesses cover up to 6 months of payments for different small business loans. Again, that's details on that might be more of a banker question, because I also know they have several different programs for those type of things, but that is what the small business money is allocated to be. So that was your breakdown, the 377 billion, 350 billion for forgiveness loans. And that's why I said loan forgiveness grants to try to keep your workforce and pay for your expenses. 10 billion for short-term emergency grants, like short-term $10,000, and 17 billion given to cover up to 6 months of payments for helping people with their small business loans that they may have already had or got behind or whatever it is. That's the small business rescue plan as stands. It's I believe it's imperfect getting it through, but I'm just saying, and I encourage you, if you are reaching out about your small business, to not give up. As someone brought up, you have staffs that are heavily reduced working from home. So to make sure you find out the best way it works for you, emailing, going online, whatever, I do know some people personally, they're not on the call, but people in the restaurant business that have said they've gotten in contact and they're starting the process. I don't know what that means. They haven't been far enough for me to be able to tell you how that's going for them. But I do know some people that are already trying to apply and look into things. Um, and also, did you want me to do an overview on the unemployment?
You, girl, you have been so amazing. It is up to you. I mean, I feel like this has all been amazing. So if you got the time and you can definitely do it, feel
Okay.
free to. And then I would like to hear from people, just because
Sure.
I want to post check how everyone is doing.
Yes.
You say 2 words like, hey, I'm doing great, or, tough
Perfect.
season, just know we have 3 therapists, 2 therapists in the group.
Yeah.
So I'll have them put their information in the chat so people can be able to contact them. And then Bianca, I think we owe you something. We gonna get you something, girl, because you have been fabulous, honestly. Like I said, we always feel like healthcare is like siloed out. So for someone to bring this information to us, like, we, in the depths of our heart, we appreciate it.
No, I appreciate you guys. It's a lot of information. I'm gonna put my personal email in the chat. I can put my work one too, but I'm put my personal email in the chat. So if you have like a specific breakdown, like you want a further breakdown of some portion, that way I can go pull that research and probably give you more than you wanted to see, but I can find it for you anyway. The only thing I'm going to touch on, and then I am going to be quiet, is unemployment insurance. Could I always get that question? Just so you know, these are the things they're doing to try to speed up the unemployment insurance process. So they're upping your full paycheck replacement. If people have ever been on unemployment, I have been before. They don't. It's usually not what you made, you know. But they're doing an increase of $600 for every American, on addition to whatever you would have qualified for in the past in your unemployment. They're waiving your waiting weeks. There used to be amount of time you had to wait before you got a first payment. They're waiving that, meaning that once you get your info in and you're qualified, they're trying to get your check out in that next batch, whatever it is. They're extending it by 13 weeks. Again, there's usually a time period of how long you get unemployment, whatever that would have been. They're adding 13 weeks. And now this part's important, especially if y'all know people that are in the gig kind of industry. They're expanding access. So now part-time people, self-employed folks, and gig economy workers. You work gigs, you don't, work steadily for a thing. You now can access unemployment insurance. You now can apply for it. You have to go through the process, but now you're not like, oh, you were part-time, or oh, you're a gig worker and I don't know how we can do that. They have expanded and opened it up to allow folks to apply that are in those industries. And like I said, including self-employed. I'm sure they're going to ask you for every document under the sun, but now you can still, even if you're self-employed, qualify to apply for unemployment insurance. So, and with that, I shall be quiet and thank y'all for y'all's time.
Thank
Oh,
you
we have
so
a
much.
question.
I don't know if you're talking to me. Hi, this is Courtney Marie. I had a clarifying question on, you spoke about the mortgage relief for individuals.
Okay.
Has there been any specific relief for renters or people living, individuals or families living in an apartment or renting?
All right, I actually have something on that too. Goodness, where is it on here? I do have it. I'm looking at it while I'm talking to you. Again, from this level, if you're basically landlords or whoever that are, I'm sorry that I'm looking to the side from here while I'm looking, but they had something where if landlords had some kind of federally backed mortgage, if basically if you're dealing with the federal government, they have also a 6 month. I'm probably gonna look at it while we come up. There was something where if you
No worries.
own a property and it is a federally backed mortgage property or whatever, that they are supposed to basically, they're going to get their mortgage basically stopped, and they're not supposed to be putting out people that are renting and everything else. A lot of people we know, unfortunately, that own buildings aren't necessarily federally backed. You got, all these different people in there, investors and whatnot. But from this side, there's something in here, some provision, and I'm going to look while y'all carry on because I did find it and I'm trying to see where I put it. But if it's something federally backed where they're supposed to do basically like a rental stop. They're not supposed to. They're not supposed to, of course, do the evictions and mortgages, but they're also not supposed to add fees or anything else to folks during that time if it's federally backed. A lot of you, what
Okay.
you've heard in Texas is evictions have been delayed, which is
Hmm.
true on a county level, Dallas County and whatnot. However, I have not seen anything that makes it where fees don't still accrue, and basically courts aren't doing eviction kind of hearings anyway. So by default, they were going to get delayed anyway. So some of it's political theater, people saying, "Oh, I'm protecting you," and it's kind of like, well, they couldn't put you off. You tried. You can't have a court date right now. So one of the pushes we have is that from a state and hopefully federal level, at some point, you get more of that relief so that people that own the buildings aren't put out, but then also so that people are in the buildings where you aren't just delaying something where all of a sudden they're like, well, it's great, I want to get put out now, but as soon as this is lifted, all of a sudden I'm gonna get a notice and have all these days and fees, and it's gonna be impossible. So locally, we're trying to figure out what can be done to really protect people.
Thank you.
No problem.
Thank you for that.
No problem.
I've been in the process of going back and forth with my landlord. So
Yeah.
yeah,
Yeah.
but their response is kind of vague. Ask family and friends.
Yeah.
Use stimulus check. Okay, those are things that are not here right now. We've exhausted all of those possibilities. So,
Yeah.
and when you pay for two mortgage, I mean, I pay for where I live and then my business. So I have two different mortgages.
Right.
We can't really do anything when there's not any work coming in. So
look, we're still trying to get people that are on non-violent, like I got old traffic ticket offenses out of jails right now, where you got cases going through and what that's going to turn into. So it's just been a lot of what you think would be some common sense practices that people really, I don't know, it's not moving. So it's just keeping that pressure, but definitely what you talked about, because that rental assistance is prime, but then also so is some mortgage relief, because not all landlords are bad folk. There's probably some people on this line that maybe you have a house that you're letting, that you have someone in, and you're like, no, I have no desire to put them out, but y'all haven't stopped my mortgage on that. So if they don't, so it just becomes this thing.
Right, like everybody's owing somebody and they're all
right.
Yeah, it's kind of like, okay, I got my money, I got my morals, I got my family, they got their family. Like, what do I do? So that's why it's really important. And I will say, and I'm gonna be quiet again, I think this is a master class of showing how local politics impacts you very directly, but also showing that how state and national in times like this is where they all come together. And we
intersect.
need to be mindful of who we're placing in these positions locally, definitely, because that's the impact every day. But state and national, we can't always even just throw off national saying, well, they don't really do nothing, it's all this, or these folks, like right now, we're seeing how all these three sections are like combining to either get work done or to be problematic and slow work down.
No, I think we talked about it in the chat and we were like, okay, bottom line, go vote, right? It's just
right.
all
Where's
of
my
our
shirt?
come to
Black women vote.
honestly.
Kind of
What
speak.
questions do you guys have with
Can I say one more thing about the renters and the mortgage whole situation? I know for people that are renters, it does depend on your municipality that you live under. So I know if
Can you repeat that?
so it depends on your municipality that you live under. That just basically means like your judicial district that you live in. So like Dallas County, Tarrant County would be like Arlington. So you can actually go look on the website for your municipality that you live in. And right now, blanketed, it's about 60 days right now that they can't evict you, like Bianca was saying. Also, the benefit that I did see was that if you, and like Talia was saying, that there's just a lot of bills due. If you have late payments during this 60-day period, that they will not count or hurt on your credit report. So that's one of the biggest things that I know I worry about. Something like, girl, I need good credit. But if they try to put it on your credit report after the whole situation is kind of completed, you have the right to pull your credit report and dispute that, because they are not supposed to be reporting any late payment within this next 60-day period on your credit report. None of this is really supposed to hurt you. And I know if you have credit cards too, check with your credit card company, because a lot of credit card companies are working with um, their clients and their customers to either do some type of payment plan or something where they will not report late payments on your credit report as well. So those are two really big things that will help if you find yourself in a position where you're not able to pay for some reason. Don't just not pay. Call them and try to work something out to, whether it be your apartment or, your landlord or your credit company, where I know for a fact a lot of them, Discover Card is one that they are not reporting late payments on your credit report. So that'll be really good to not hurt credit.
Love it. Love it. What other questions, comments, concerns, things that you guys are dealing with that you want to share?
I like that Alexandria was talking about the renters, going into detail about that. I guess because I've never been in this situation or lived through a pandemic, if there was an instance where you could not pay your mortgage or your rent for the month of April, are they wanting that doubled in May or June? Like, if you don't have any substantial income coming in because COVID-19 has shut everything down, what are you to do? And you're not getting answers back from small business relief, or you haven't received your stimulus check, or you've exhausted or, exhausted your savings, anything like that. Like, what are you to do?
Can I answer that? I'm sorry. I'm not an expert. I just be knowing information because I be researching. Because first of all, knowledge is key. So if you have any question, Google research, call folks, all that. But I know that Bank of America, my mortgage is through Bank of America and it's backed by Fannie Mae. And then certain car companies as well are doing it instead of you paying, that payment or adding late fees to it. If you call them, once again, you have to call and ask, or they probably will not do this, that instead of you paying, April or May, what they will do is put that payment at the end. So let's say
That's what I did with
it's
my
a
car.
and you have 3 years of payments. Instead of paying at that time, they'll just put it 3 years and 1 month or whatever the case. And some of them are even doing that without doing fees. So that's the biggest thing I'm seeing. They're not doubling the payment on the consecutive month. That kind of wouldn't make sense. But I've seen them stacking it at the end of that lease term or that payment agreement.
And they can use your deposit as well. I know that's I don't know if you mentioned it or
Oh, wow. I pay quite a bit. Yeah. I think I pay like 3%. So
if you did first month rent and deposit, you can negotiate with them to hold your deposit, and either you don't get your deposit back if you don't pay it, or you can pay it and get your deposit back. But I know for a fact that they can use your deposit. Like I know people who couldn't pay their rent and negotiated their deposit.
Oh, I'm gonna look into that. Okay, that's cool.
I can speak to a little bit of that, Janelle. What I'm seeing happen is, so I am a landlord. I have some properties. I don't have any here in Texas, but particularly in Oklahoma and California. And what we're seeing from a lot of our companies that are kind of managing our properties for us is they're kind of sending out kind of options for people how they want to deal with it. Do they want to use their deposits to cover those months, or do they want to kind of use it as a back end? Maybe once we're starting to make payments, do they want to add additional funds? Some of the families that I have like a personal relationship with, that I deal with their rent on the day to day. I'm kind of just checking in, kind of getting a feel for what works for them. So I think that trying to reach out to your landlord, because prior to the stimulus package, as landlords, we were kind of panicky about, were we going to get paid?
Right.
Because we did receive ordinance that we couldn't evict people. So I think that fear was like, were we not going to get paid? But now that the stimulus package has come out, I think you see a lot more landlords and kind of leasing facilities kind of having an understanding that they're going to be taken care of regardless, particularly because their banks aren't because their banks aren't collecting money. So, we have to go in there. It takes about 5 minutes, fill out a form, and then that puts our payments on hold. And a lot of times we're taking that and saying to our residents within our homes, like, hey, don't worry about it right now, like, because everything's going on. But again, that's some and most from what I hear. But then you also have those who, they feel like I'm going to get my money regardless. So, but again,
Right.
they can't kick you out. And then I know in California, if there's some issue with maybe them not kicking you out, but at this time, but some type of retaliation, then California is siding with the resident instead of the landlord, so you can sue that landlord. So it just varies. California is a very liberal state, so it's a little different. Kind of they're pro the consumer, so it may be a little different. And I know in Oklahoma, Oklahoma is a little bit proactive too, with letting landlords know, hey, we're not evicting people, and they're giving different options on what the landlords can do in order to make sure that they're not losing out on money. So most of the landlords are taken care of. Again, if you have somebody who's being shitty, you can probably report them.
Okay.
Process.
Hey Janelle, it's Portia. I'm a realtor here in the
Mhm.
state of Texas. So just kind of wanted to add on a little bit. But Texas does look out for tenants. So as long as you're communicating and showing goodwill and good faith that you are indeed trying to do something, usually the law is on your side. I don't know if you're aware, but whenever people go into foreclosure, mortgages and banks usually give that person a lot of time in order to get payments together. It's not like, oh, you didn't pay this month, tomorrow you're out. That's not the case at all. They really try to work with them because it's a lot better to deal with the person that you have in there rather than to try to find somebody to fill that position. So just make sure you're keeping up with that communication, trying to
Right.
do everything that you can. And then if you do get in that predicament where, okay, they're really trying to come after me or kick me out, usually most of the time the law is on your side.
Okay. I've been in communication with everyone. So, well, brief background. So I'm originally from New York. So I'm dealing with a lot of stuff up there, well, in Dallas. I've gotten family members that have COVID. So they're on lockdown. The whole state is on lockdown. I was actually supposed to be there on Tuesday, but I had to cancel my flight. And, it's very hard not being able to get to your family. So I've been delivering food through Instacart to my grandparents, to my aunts, my uncles, my cousins, and dealing with that because I guess they've made me the responsible one and had me do everything. But trying to make sure that I take care of things that are here. Going back to what Bianca said, I'm a small business owner, and because the pandemic that we're in, I can't work. So doing that actually oversees my quote unquote 9 to 5. That's where most of my income comes from. So when that's not coming in, I'm juggling different streams of income to make sure that everything is afloat while trying to take care of the family. So here we are.
Another quick point too about the unemployment changes right now too. Again, and if you've ever been on it, you'll know in the past, again, personal experience, they used to, one of the requirements to keep it coming was to show that you had X number of interviews and you've looked for work in X
Right.
number of places. They're waiving that as well right now during the time,
Okay.
just because it's kind of like, where I'm finna look? I only got this many places, so I just wanted to add that in there too, that with the other changes, they're actually also waiving or lightening up on the whole. In order to keep this, you have to show that you looked up 5 to 10 jobs every week.
Right.
That's waived
Right.
too right now during this national.
Oh, that's good.
Yeah.
That's good. It's kind of crazy because even here in Texas, I personally know friends that now have the coronavirus. And I'm like, where were you at? And they're like, literally, it could be touching something in the store. It could, is it airborne? I don't know. I've been inside, but I stepped out and gone to the store to grab something and I'm back. And now I can't breathe. Like one was in the hospital having respiratory issues. So, and they're my age.
Yeah.
So no, it's not just older people and, elderly. It's can affect anybody.
Yeah, I have a friend, I will not share his name, obviously, but just was was in college, wasn't out there like partying or anything like you said. I mean, other than going to the store, and I got news 2 days ago, but we've been talking to his wife. He's doing better, but he got put on a ventilator, and he's literally like right at about 30 years old. Like, now I will say like he has diabetes, but a lot of people I know have a gazillion. I have asthma. I mean, there's a lot of things going on, but just the fact that it escalated from I felt kind of sick and it happened so fast. That's what she was saying. People don't realize from when he first started being like, "Oh, I'm not sure if this is is this a cold, what?" And it just like within a couple of days to the point of him having to get like a ventilator, which was like
Wow.
just yeah,
At
it's just
30.
mind blowing. But like
Goodness.
you said, it's not just older people and it's not just younger people. It's just people need to take it seriously because you really don't know the impact it will have or the danger that even if you're asymptomatic that you can pose to
Other people.
other people. So you're
I
right.
know they put out a video, and I'll try to find it and share it, but they did put out a video on ways that you can clean your groceries, even if you are still doing like Instacart or things like that, when it arrives to you, like wiping everything down. And my mom is immunocompromised, so I'm big. She wants to go to the grocery store because that's her only outside, and she's a veteran, and so she has some other like PTSD issues, and so she's struggling with the social aspect of it, and not being able to get any connection, and kind of missing out. And so I know that's a tough part, A, because she's so far away, and then B, because I know she's not getting what she needs to thrive, mentally and socially. So I completely understand. I think another thing I wanted to kind of touch on is just the stigma that's out there, which is just a lot of negativity. But I remember people were shaming people who were having these quarantine parties of like 3 and 4 people, and I started to see that it became very easy for us to attack each other with practices and things that we were doing. Ultimately, it's community spread. It is airborne. So a lot of the talk of what we do in the hospital is it droplet or is it airborne? We're gonna assume it's airborne in the sense of you want to have the strictest measures. We try to prevent in the beginning people from wearing masks to these like regular places because it was kind of like if you're using the mask and the healthcare professionals need the mask, if you practice social distancing, you might not have to wear the mask as frequently and as well as staying in the house. But we noticed that airborne was more so if a patient is getting like an aerosol treatment, like a nebulizer treatment, if the patient needed to be intubated, things like that, we were going to have them use the entire airborne PAPR hazard things. Otherwise, just the N95 or the droplet mask was enough. So you started to see the shift in people thinking, oh, that's just for elderly, to, oh my God, anybody can get this and anybody can recover. The virus does attack your lungs, and so it's very specific to the lungs, and so that's why the need for the ventilators was the primary concern, is that we have what's called ACE receptors in our lungs, and so that's where it wants to go. Side note, we also have ACE receptors in our gut, and so a lot of people were having the nausea or not eaten. That was one of the secondary symptoms that people started to notice, is that they were either nauseated or just didn't have an appetite for a while, and then they were the ones that were coming up positive, and that's because that's one of the ways that the virus exhibits itself. So I feel you guys, and I think being knowledgeable is is the biggest way that we can combat fear. I've been hearing people say, oh, pulling up videos of things that said the coronavirus was out before. I wanted to emphasize, it's a reason why we're calling it COVID-19, is because coronavirus is a series of viruses, and so it encompasses SARS, it encompasses things that were already out. So when you're watching movies and pulling articles and TED Talks and things like that that says coronavirus was planned, or things like that, they're talking about a series of viruses that may or may not have already been out there. So you want to be specific to identifying this as COVID-19, because that is going to highlight it in this era.
Yeah, I was gonna if that's okay. Hi, it's
Yeah,
Bim.
go for it. Hi. We have friends here, guys, from Urban League.
Yes, so happy to be on with you guys. I wanted to respond to Jane really quickly. One of the things you guys should be looking out for in the coming weeks are the foundations and what are the foundation's responses to assisting people with monetary needs as well as other needs in the house. So the 4 large foundations had a call earlier this week, and they discussed some of their responses. A lot of them are creating a specific fund to alleviate these challenges, both for the nonprofits that are servicing individuals, but also creating a fund where people can apply directly, maybe perhaps for rental assistance or to buy groceries or some things like that. So there are some giving funds that are going to start popping up in the Metroplex here in the next, I think, 2 to 4 weeks, honestly. And they'll probably outline what their processes are. I know one of the consensus from the call is that they're going to really lax the application process, and a lot of them have actually created a common application as well that can be used across the board by all of them, kind of like the Apply Texas. If you guys have ever seen the common application for college, it's like one application that services like multiple colleges and universities. And so it makes it really easy for your work or your need to be compared by a lot of people or seen by a lot of people. So those are definitely some things to look out for, where you can apply for some of those assistance, that financial assistance, while you're kind of in between for that. There's also a lot of organizations that are helping small business owners, everything from Yelp to Bumble. They're like, I think they were doing like $5,000 gives to small businesses. So those are definitely things to take a look at and apply. A lot of these kind of social media following pages are doing a lot to bolster support or drive services to your product or your service as well. And I think that's kind of another way of resourcing income, is advertising it to a market. I know at the Urban League, that's going to be one of our strategies, is certainly giving exposure to businesses that are owned by Black young professionals, as well as creating a giving fund. And so those are things I know that we're working on personally, but those are some other ones that are a little ahead of the process that I just wanted to mention in case people wanted to utilize.
Thank you.
Thank you.
Do you guys have any more questions, concerns?
This was great.
That you guys enjoyed.
This is really good.
That's good. I'm glad we had about 20 people show up. So I wanted to make sure that people got this information. And again, it was really just a thank you, because I saw that we were kind of siloed. I saw that we were kind of struggling. We do great with sharing information and sharing resources. So whatever the need is, please make sure to share it. I want to make sure that we're building a community in the sense of really identifying what those challenges are that we have. And if other people have resources, I mean, I think our greatest resource to each other has been knowledge. And I think my heart is just so grateful that we all are knowledgeable in these different sectors and these different areas, and we've been able to share it with each other and connect with each other. So I appreciate you, Bianca, so much. Like, you don't understand, like, so much for doing this, just bringing that information down to us and putting it in terms that we understand, reading an 800-page document or skimming through it or whatever you had to do to get the information. We appreciate it. And however we can support you, please let us know. And then we have to definitely pray for each other. So just collectively, just thanking God for, bringing us through. I think healthcare workers were able to really come through this a little bit more resilient because we were in higher need as essential workers. But that still doesn't mean that we didn't witness a lot of the grief and a lot of the pain and things that people are going through. So just stay lifted up in prayer. And stay connected. I hope to have a few more Zoom calls, just depending on how far this thing goes. If you guys have topics, please let me know. Sometimes I'm a little out of the loop in what you guys need. So, be sure to share it, send messages, DMs, things like that, and say what you need so that I can find those resources for us and bring us all together. So thank you.
I actually have a question. Really quickly. It's probably for Bianca, since you're kind of in the politics realm. So I know I was reading, and I know, like, Representative Maxine Waters and some of the other strong female Democrat leaders that we have are trying to pursue a bill for about $10,000 or so forgiveness loans. Do you foresee that or something similar to that being possible, just seeing all the turbulence of the CARE Act being passed, the timeline behind that. So this is of course just your opinion on it, but I just kind of wanted to hear your opinion since you do have a political background.
You were saying it was about business loans?
No, it's a $10,000 relief, an amount of relief for student loans from the Democrats.
Yeah. This is that student loan is one of those things that what the chatter has been on the other side of that is, oh, it's just those guys trying to push through things that we already said we didn't want to do, and they're taking advantage of the crisis. That's the wording from the opposition to what you're saying. I will say it depends on how long this goes, and honestly, how the market and a lot of things are going, as far as how much people might start feeling pushed to look into things. I know at one point someone wanted to do like, they wanted to do like 30 to 50,000. So I think the 10,000 is already a compromise on their end. Like, hey, let's do something. I know currently the only something that was given as of now that they could agree on was well, we won't do any more, we won't do any fees and interest, which I always take those things as, while that's really small, at least it means that a piece of the conversation was had, and there's the thinnest of thinnest cracks in the door, but sometimes there's no cracks in the door. So hopefully, well, not hopefully this goes a long time, but hopefully if this goes a long time, they will say, hey, that was a good first step. We appreciate it. Thank you for coming to the table, but we feel there needs to be something more expansive. And then maybe you'll get that 10,000 relief. The problem is the whole party isn't on one line on that either. There's some inter-party bickering, and that can make it hard. If you don't already have your group on one accord, it's hard to go to the other side and say, hey, we're trying to push for this. So I won't say it's impossible. If they do it strategically, we're thinking of, we appreciate this being done, but let's talk about something we can do more, because there'll be more of these relief bills. There's going to have to be some other ones, like sectors. So I'm actually hoping they keep pushing at it, because I always, from a strategist side, I always tell people not to think that something's impossible or that something can't get done, because even things that were seen as radical and revolutionary and unheard of at one time, it took some people, usually a small group, that expanded, bringing it up, not letting it die, and eventually you get the traction to actually make something happen. So I know that doesn't completely answer, but I don't think it's impossible. I don't think it would be like this month or this, but I think it's still something that they need to keep elevating to keep it on the table. So.
Right. I know one of the biggest rebuttals that I was kind of hearing is that the federal student loans do help to, fund certain areas of the government. So that's why they didn't want the relief to be, this grandiose type effort. But I know you just have some insight that I'm not privy to. So that was awesome, your answer.
Oh, yeah. And some of what they look like, too, is comparing it to some of the bigger business bailouts or money or relief people are getting there, and saying, why can't we just do a 10th, that, like you said, a general, like a smaller number just to people on the ground right now. So I know that's another thing they're trying to compare it to just say it's the same concept, lighten it a little bit for folks. And then that comes right back into economy, because you're giving people a little breathing room to be able to, function and
spend money when this is over. Right. Okay. Thank you so much.
You're welcome.
Alrighty, guys. I will be reaching out. If you sent your email or if you're in the group, I have your information already. If you've subscribed to our newsletter, I have your information, and I'll send out the recorded version of this so that you guys can have a reference. And if you guys have any information, again, feel free to share it in the group me. And if Bianca sends me anything, I will definitely forward that to you guys. And we'll continue the conversation. So this is definitely one of many.
Thank you.
Thank you so much. Have a good evening.
Y'all have a great
Thanks for having me.
Bye.
Thank you.